multiple tours in Iraq and Afghanistan are stressing the ranks of the U.S. military. And last year, the Army reported 128 suicides. The Marine Corps says that there were 41 suicides of active duty members, and that's the most since the 2003 invasion of Iraq. Well, the family of Marine Major John Ruocco knows the pain behind those numbers. In the 3 months after he returned from a tour in Iraq, he had nightmares, he lost weight, he was withdrawn, and he was distracted from his 2 young sons. He promised his wife, Kim, that he'd get help, but the next day, the 40-year-old Cobra pilot killed himself.
2 days past 18, he was waiting for the bus in his army green, sat down in a booth in a cafe there, gave his order to a girl with a bow in her hair. He's a little shy, so she gave him a smile, and he said, would you mind sitting down for a while and talking to me? I'm feeling a little low. She said, I'm off in an hour and I know where we can go.
PTSD is an anxiety disorder that arises from someone being exposed to a traumatic event, usually when they feel that their life is threatened or someone they love's life is threatened, or that they're going to be seriously injured.
I cried, never gonna hold the hand of another guy, too young for him, they told her, waiting for the love of a traveling soldier. Our love will never end, waiting for the soldier to come back again.
It is a huge impact on the family. You have someone coming back from war. He may have gone 15 months. His child may not even know him. His wife has been running the household all alone, or husband in that matter, and now has to fit another person into their life. That person may be angry, may be drinking too much, may have triggers that turn him or her into rageful individuals. There's been instances of a lot of increase in domestic violence. There's been a huge increase in suicide. Last year was the highest suicide rate for returning vets ever. It was at 105.
There's something happening here, but what it is ain't exactly clear. There's a man with a gun over there, telling me I got to beware. I think it's time we stop, children, what's that sound?
More time, money, research, and education should be dedicated to the mental health of our veterans.
There's battle lines being drawn, and nobody's right if everybody's wrong. Young people speaking their minds are getting so much resistance from behind.
Families and veterans need to be educated on the risk factors and symptoms of PTSD and depression, and should be encouraged to seek help and support if needed.
I always tell people when I give them a diagnosis of PTSD that I've got good news and bad news. The bad news is you have PTSD, and it's bad news because it's an awful disorder to have. It's an awful way to have to live your life. The good news is we do have good treatments, and we have several options for treatment. So we've got a couple of plan A's that even if one doesn't work, we've got other good alternatives. And I really believe I've seen people who told me, I don't know why I fought so hard to survive if this is my life now. And then they have said, after treatment, I feel like the person I was before this happened, and I didn't think that was possible. It doesn't happen for everybody, but I know that it's possible.
Community efforts and government programs such as the VA and American Legion work together to help assess and consult with the veterans who suffer from PTSD through policymaking, research funding, and healthcare support.
Mostly say hooray for our side. It's time we stop. Hey, what's that sound? Everybody look what's going down. Paranoia strikes deep. it will creep. It starts when you're always afraid. Step out of line, the man come and take you away. We better stop. Hey, what's that sound? Everybody look what's going down. Stop. Hey, what's that sound? Everybody look